You know, when you drop your kid off at school, there's just this unspoken assumption that the building they're walking into is equipped to handle, well, whatever happens to them that day.
Right. It's a very comforting thought for parents.
Yeah, exactly. Like if they scrape a knee on the playground, there's a nurse down the hall. If they're struggling to understand fractions, there's a math tutor or resource teacher ready to step in.
Mm,
We inherently view our schools as these, completely self-contained safety nets. But right now, there is a startling, quiet crisis that school administrators are just losing sleep over.
they really are.
And yet, if you're a parent listening to this right now, you have probably rarely, if ever, even heard about it.
Well, it's the kind of systemic stress fracture that stays completely hidden right up until the moment it completely breaks.
Yeah.
We tend to assume the safety net is fully funded, fully staffed, infinitely capable. But when you start looking at the actual logistical capacity of our education system, a wildly different picture emerges.
Which brings us to the core mission of today's deep dive. We are unpacking the reality behind the sources on the 48% gap, scaling student clinical capacity.
And that number is staggering.
It really is. According to the National Center for Education Statistics for 2026, only 48% of U.S. schools say they can effectively provide mental health services to all students who need them.
Wow.
Let that sink in for a second for you listening. Less than half of our schools feel equipped to support the mental well-being of their student body.
And, we aren't talking about specialized, ultra-rare psychological interventions here either.
Right.
We're talking about basic, necessary clinical capacity. This is about having the framework to handle the everyday anxiety, the depression, and trauma that students are just inevitably carrying with them through the front doors.
So today we're going to explore exactly why this massive gap exists and, why the old traditional ways of trying to fix it are completely failing.
Because they definitely are failing.
Absolutely. And more importantly, we're going to look at how an innovative partnership model specifically, we're going to examine a blueprint from MentalSpace School down in Georgia.
Which is super interesting.
Yeah, we're looking at how that model is offering a structural solution to what is, at its heart, a structural problem. Because to understand the solution, we really have to look at the trajectory of this crisis first.
Right, the timeline.
Exactly. And the trajectory is grim. 48% is a deeply concerning number, but the real shock is how fast we actually got here.
Oh, for sure.
Just 3 years ago, that figure was at roughly 58%.
Yeah, so in a relatively tiny window of time, a massive chunk of our schools simply lost their capacity to handle student mental health.
10% just gone.
Gone. The trend line is moving aggressively in the wrong direction. And it's vital to understand that this isn't some sudden lapse in competence.
Right.
School administrators didn't just forget how to do their jobs. It really comes down to three massive structural shifts colliding all at once. It's basically a perfect storm of decreased resources and increased need.
So I want to break down those three structural shifts because it really explains the actual mechanics of the crisis.
Let's do it.
First, we have the end of the pandemic era ESSER funding. Those federal relief dollars just dried up completely.
They vanished. Yeah.
Second, there are these unresolved chronic hiring shortages. Schools literally cannot find the professionals to hire. And third, there is a continually climbing demand from the students themselves.
Yeah, and the ESSER funding cliff is perhaps the most immediate trigger out of all of those. The elementary and secondary school emergency relief funds, they were a lifeline.
The total lifeline.
While that money was active, schools were patching the holes in their mental health coverage. They were temporarily expanding programs, paying for overtime.
Bringing in short-term contractors, right?
Yeah. Exactly, short-term contractors. But those were always temporary dollars. The structural shortage of licensed professionals in the workforce, that never actually went away.
Wow, so it was basically a Band-Aid?
A very expensive Band-Aid. So when the federal money vanished, districts were left with more identified need than ever before and significantly fewer hands to actually meet it.
Let me try to put this into perspective because, it's so easy to hear the phrase funding shortage and just think, oh, budgets are tight, they needed to prioritize better.
Right. People just think schools are wasting money.
Exactly. So imagine a hospital trying to run a surging emergency room. Patients are flooding through the doors every single hour, but overnight, half of their medical supply budget just entirely vanishes.
That's terrifying.
Right. And on top of that, the hiring pool for nurses has completely evaporated. You put out a job listing for a triage nurse, And 0 people apply because there simply aren't any available in your zip code.
They just don't exist.
They don't exist. You cannot just tell the remaining doctors to, work harder to fix a math problem like that. You can't outwork a structural deficit of that magnitude.
That analogy hits the nail right on the head, honestly. This is absolutely not a story about schools failing their students.
Right.
I think that's a trap people often fall into, blaming the administration or, pointing fingers at the teachers for not doing enough.
Which is so unfair.
It's totally unfair. This is actually a story about a funding and staffing model that completely, utterly failed to keep up with a generation's actual clinical needs.
Because the old model relied on what, exactly?
Well, it relied entirely on schools building self-sufficient clinical ecosystems inside their own walls.
Which works great if you have an unlimited municipal budget and a massive surplus of local therapists just waiting around for a job offer.
Right, which is nobody.
Literally nobody. But since almost no district has either of those things, we are seeing the smartest districts adapting just to survive this period.
Yeah, they have to.
They are abandoning the in-house only approach. Like if the counselors aren't in your town, or you don't have the budget to hire them full-time with the benefits and the pensions, you have to change the paradigm.
Exactly.
And the shift we are seeing across these sources is a move toward a partnership model, bringing in external clinical teams. But wait, hold on. I have a major problem with this.
Okay, what is it?
Well, if a school brings in some outside, corporate clinical team, aren't they basically just outsourcing?
I see what you're saying.
Like, I'd be furious as a parent if my kid was having a crisis and got handed off to some random stranger on a screen instead of the beloved school counselor who actually walks the halls, goes to the football games, and knows these kids on a personal level.
I hear you. And that is the immediate fear for almost every parent and teacher when they hear the word partnership.
It sounds super corporate.
It does.
It
Sounds like code for replacing the human element with a cheaper outsourced alternative. But the partnership model is actually designed to do the exact opposite.
Really? How so?
It saves the school counselor. The school counselors absolutely must remain the critical relational front line for the students.
Okay, so they aren't going anywhere.
No, not at all. They're the ones who know the kids, who spot the subtle changes in behavior in the hallway, who provide that immediate familiar comfort.
So we go back to my hospital analogy. The in-house counselor is essentially the triage nurse.
Yes.
They are doing the vital relationship building and that initial immediate assessment.
But think about what happens next, right? What happens when that trusted counselor identifies a student who needs, say, intense, ongoing, weekly cognitive behavioral therapy for severe trauma?
That's way beyond what a school counselor has time for.
Exactly.
Right.
In the traditional model, that counselor either tries to do the therapy themselves, which is mathematically impossible when you have a caseload of 400 or 500 kids.
That's insane.
Or they have to hand the family a printed list of local therapists who all have 6-month waiting lists and probably don't even take the family's insurance.
And then the kid just falls right through the cracks.
Just falls right through. The partnership model changes this by putting massive, dedicated clinical capacity right behind those existing counselors.
So it's support, not replacement.
Exactly. The external teams are designed to extend the counselor's reach, not compete with them. It allows the school counselor to hand the intense, specialized clinical work over to a dedicated team.
That makes a lot of sense.
Yeah, and that frees the counselor up to be exactly what you want them to be, the relational anchor in the school building, available for the very next student who walks in the door.
Oh, wow, that completely flips the perspective. You aren't replacing the triage nurse, you're finally giving them an actual hospital wing to send the severe cases to.
That's exactly it.
So let's take this from the theoretical and look at a concrete, real-world blueprint of how this actually functions. We've been looking at a specific operation down in Georgia called MentalSpace School.
Yes, very interesting case study.
How does a partnership model like this physically work on a day-to-day basis inside an actual public school?
So, MentalSpace School provides comprehensive K-12 mental health support, specifically tailored for Georgia schools. And they've structured it to be a true logistical fix.
Oh, okay.
They aren't just offering a 1-800 number for kids to call. They provide same-day teletherapy access for students who get flagged by that frontline school counselor.
Wait, same day?
Same day.
Oh.
And crucially, they have dedicated therapist teams assigned to each specific school to ensure continuity of care.
Let me stop you there because the logistics of same-day teletherapy in a public school setting sounds wildly complicated to me.
It does sound like a lot.
Let's walk through the actual user experience for a student. Let's say a kid has a severe anxiety attack in the middle of third period math.
Okay.
They go to the counselor's office. How do they actually access this therapy right then and there?
So the student goes to the counselor who provides that immediate in-person stabilization we talked about.
Right, the triage.
Yep. Once the counselor determines this student needs professional clinical intervention, they don't hand them a wait list. Instead, the student is set up in a designated secure space within the school.
Like a private room.
Yeah, often a private room, right adjacent to the counselor's office or the nurse's suite. And through a secure provided digital portal, that student is connected within hours, sometimes even minutes, to a licensed therapist.
And it's not just a random person picking up the line like a call center, right? Because continuity is huge for therapy to actually work.
Oh, absolutely. It is a dedicated team that is specifically assigned to that school.
Oh, that's smart.
The therapist on the screen actually learns the culture of the school, the administration, the common issues those specific students are facing.
So they really get to know the community.
They do. And it goes
Oh.
well beyond just individual therapy. MentalSpace provides crisis intervention, suicide and violence prevention programs, staff wellness support.
Which is incredibly crucial right now given the rates of teacher burnout. So crucial. And they also do family counseling. Plus, the workforce they deploy consists of fully licensed, diverse therapists who are culturally competent.
Meaning they can actually relate to the kids.
Right, ensuring they can actually connect with the specific demographics of the student body they serve.
Okay, so the clinical side sounds incredibly robust. But anyone who has ever worked in or around a public school knows that schools are just notoriously bogged down by administrative red tape.
Oh, a mountain of it.
Integrating a complex, fast-moving clinical operation like same-day therapy into a school environment sounds like a complete legal nightmare.
Can be.
How on earth do they do this without violating a mountain of privacy laws? I mean, the liability of managing medical records and educational records simultaneously sounds terrifying for a principal.
You're totally right. And that fear of red tape and liability is exactly why so many school districts hesitate to innovate at all.
They just freeze up. Exactly. They simply don't have the legal teams to figure it out. But the defining feature of a pre-built partnership model like MentalSpace School is that the entire infrastructure is built from the ground up to be fully HIPAA and FERPA compliant.
Okay, so they handle the compliance?
Yes, they take the compliance burden entirely off the school's shoulders.
Which is huge. Just for those listening who might not be, deep in the weeds of education law, FERPA protects the privacy of student education records, and HIPAA protects medical records.
Right?
Blending those two usually creates a massive administrative headache.
It's a huge headache. And in Georgia specifically, managing this is becoming a massive urgent issue right now.
Why is that?
There is a critical looming deadline, July 2026. Georgia schools are facing a state mandate known as HB 268, which literally requires them to have comprehensive mental health policies and protocols in place.
Oh, wow. So it's not optional anymore.
Not at all. Administrators are pulling their hair out right now, trying to figure out how to build this compliant infrastructure from scratch before that 2026 deadline.
That's a lot of pressure.
And that's where MentalSpace comes in and provides a plug-and-play solution. It not only meets the clinical needs of the students, but it supports schools in achieving full HB 268 compliance without having to hire an army of consultants and lawyers.
So they essentially hand the school a fully compliant, secure legal framework wrapped around a team of licensed therapists
Precisely.
that covers the logistics, the user experience, and the legalities. But this naturally leads us to the absolute elephant in the room.
Let me guess. Money.
Money. Honestly, it's the biggest hurdle for anyone trying to understand how this is actually sustainable. Let's talk about the economics.
Okay.
We established in the first few minutes that ESSER funds vanished and school budgets are drying up across the board. So how is any of this paid for?
Well, the financial architecture of this model is perhaps the most elegant part of the entire system.
Really?
Yeah. MentalSpace bypasses the school's budget entirely.
Wait.
The school does not pay for the clinical hours of therapy. Instead, MentalSpace handles the insurance billing directly with the families.
Oh, wow.
Yeah, they completely remove the school district from the financial transaction of providing the care.
Okay, so the school acts as just the facilitator. They provide the secure location, the internet connection, and the trusted counselor to make the referral.
Exactly.
But the school's actual operating budget, like the money meant for textbooks and teacher salaries, that isn't touched by the therapy sessions at all.
That is the innovation.
But the immediate question is always, well, what about the families who can't afford it?
Which is the most important question. And MentalSpace has structured their billing to ensure massive accessibility.
Okay, how does that work?
For families on Medicaid, the cost is $0.
Zero.
$0. It is completely covered, removing the financial barrier for the absolute most vulnerable students.
That is incredible.
It is. And for families with commercial insurance, MentalSpace is in-network with all the major carriers.
Like who?
We're talking about Blue Cross, Blue Shield, Cigna, Aetna, United Healthcare, Humana, Peach State, CareSource, and AmeriGroup.
Basically everyone.
Basically everyone. They have built the complex financial plumbing required to ensure that almost any student can access the care without the school footing the bill.
That is a fundamental paradigm shift. It really transforms mental health from a massive, terrifying line item on a school district's shrinking budget into just a standard healthcare service that happens to be delivered seamlessly within the educational environment.
Exactly. It integrates it beautifully.
So what does this all mean for the students in the end? Does this specific partnership model actually yield measurable results?
The clinical and educational outcomes are what truly validate the whole model.
Let's hear the numbers.
By implementing this framework, schools are seeing a 92% reduction in student anxiety levels.
92%. That's massive.
It is. They're also reporting an 85% family satisfaction rate.
Which, as anyone in education will tell you, is incredibly high for any school-based initiative. Parents are tough critics.
They are. But there is one specific metric that stands out above all the rest. An 89% improved attendance rate for the students involved in the program.
Now, that is fascinating. Notice how that very first outcome listed 89% improved attendance. It isn't just a clinical metric.
Right.
It's an educational one. Attendance is the holy grail of educational metrics.
It really is the foundation of everything else.
It shows you that mental health care isn't some extracurricular add-on. It's not a luxury. It is the fundamental infrastructure required to just get a kid into a classroom so they can learn. If a student is paralyzed by an anxiety disorder or dealing with unprocessed trauma from home, they aren't coming to school.
Or if they do physically walk through the doors, they're sitting at their desk completely checked out, unable to retain a single word the teacher is saying.
Exactly.
We so often separate health from education, treating them as if they're two entirely distinct silos. But a child's brain doesn't know the difference between the building where it learns and the building where it heals.
That's a great way to put it.
By bringing the healing directly into the educational space, you remove those massive logistical barriers. You remove the transportation issues of a parent having to leave work, drive their kid across town, sit in a clinic waiting room at 2 p.m. on a Tuesday, and then drive them back.
Which is impossible for most working parents anyway.
Right. The care is just there, instantly. And because the mental health barrier is removed, the student can actually participate in their own education again.
For any administrators, district leaders, or even concerned parents listening who are staring down that 48% gap right now and panicking about how to support these kids, especially with those 2026 mandates like HB 268 looming, you can actually look at the exact framework we've been discussing.
Highly recommend checking it out.
Yeah, you can go to mentalspaceschool.com or reach out to their team directly at mentalspaceschool@cheattherapy.com to see how they are deploying this. It's not just theory. This plumbing is active and working right now.
It is a proven, replicable blueprint. And frankly, it has to be, because the traditional, isolated in-house model simply cannot scale to meet the mathematical reality of the current crisis.
No, the math just doesn't work anymore. Let's take a step back and recap this journey for you, the listener. We started by looking at a genuinely daunting reality, that 48% gap.
A really scary statistic.
We are living in a moment where the end of pandemic relief funds and severe chronic staffing shortages have left more than half our schools structurally unequipped to handle the mental health needs of their students.
Yeah.
The old way of doing things, expecting schools to build self-funded clinical ecosystems, is completely broken.
But the paradigm is shifting, thankfully.
Yes, it is.
The smartest districts are moving away from relying solely on overwhelmed, isolated in-house counselors who are just drowning in massive caseloads. They're moving toward high-capacity clinical partnerships.
Like the one we looked at today.
Exactly. Models like MentalSpace School in Georgia are showing that you can deploy same-day compliant teletherapy, support your frontline staff, handle the legal red tape, and completely bypass the school's budget through direct insurance and Medicaid billing.
It's a structural solution to a structural problem.
Precisely. It honors the vital human role of the school counselor while finally giving them the clinical backup they desperately need.
Which brings us back to where we started. We talked at the beginning about how we like to think of schools as these self-contained safety nets, much like a hospital ready for anything.
Right.
But when the hospital runs out of supplies and the waiting room is overflowing, you don't blame the triage nurse. You change the entire supply chain.
That's the only way forward.
And that leaves us with a final, slightly provocative thought for you to ponder today as we wrap up.
Let's hear it.
We just explored how providing dedicated, easily accessible clinical support can instantly yield an 89% improvement in a traditional school metric like student attendance.
A massive improvement.
So it begs a much larger question for all of us to consider moving forward. How many other issues in our education system right now, things we so casually label as academic failures or disciplinary problems or truancy, are actually just misdiagnosed structural clinical gaps just waiting for the right kind of support?
Wow. That is the question that could redefine how we approach education over the next decade.
Let's hope so. Until next time, keep diving deep.